Hi everyone, I wanted to go ahead and record the Chapter 19 PowerPoint, which we did not have time for in class. This is infections of the urinary tract system. Here are the learning objectives. These may help you to guide your studying. We're going to identify parts of the urinary system that are the most common sites of urinary tract infections or UTIs. We're going to identify the microorganisms that are the most common causes of UTIs and their symptoms. We are going to identify and describe 3 most common UTIs, list the common risk factors for a UTI, identify the patient group who has the highest risk for a UTI and give reasons why, and then describe the typical diagnosis and treatment process for UTIs, and finally, discuss prevention factors for UTIs in immunocompromised patients. Okay, so if we look here, on the left, you will see a picture of the female urinary tract system, and then on the right, you will see a picture of a male urinary tract system. And I want you guys to kind of look at this and from this angle, tell me what you guys kind of notice about differences in the 2 different systems, the male versus female. By the way, guys, this is in your book. It is figure 19.5. The structures of the urinary tract system. Okay, if you guys noticed that the urethra is much longer in men, you are correct. Now that's probably not surprising and shocking news to you. That's probably something that you learned while you were in your practical nursing program. But actually, I just want to reiterate and emphasize the fact that this is a very important reason that men's typically have a harder time getting a UTI, and we most commonly see UTIs in women because their urethra is much shorter, so the bacteria or the microorganisms can reach the other parts of the urinary tract system much quicker than they do in a male. As far as our different structures of the urinary system, the main structures are the kidneys, the ureters, the urinary bladder, and the urethra. And so you see here kind of a picture of your kidneys and your bladder, and of course, the muscles of the bladder there are also very important. And you can see how the blood flows to the kidneys and so on and so forth. This is actually a nephron, and these are actually found in the kidney. So these are very fundamental units of the kidney. Each nephron has what's called a glomerulus, a Bowman's capsule, and a tubular portion that consists of the proximal convoluted tube, the loop of Henle, the distal convoluted tube, and a collecting duct. So I'm sure most, if not all of us at some point, have had a UTI in our lives. Symptoms of UTIs can be very distressing, and they can just make you feel like crap all over. So most UTIs include the following symptoms. You have an urgency to urinate. Then you have dysuria, so that's a painful or burning sensation when urinating. Not only do you have an urgency to urinate, but you also typically have frequency of urination, which means that when you do try to urinate, only small amounts of urine pass at a time. You may also have blood or pus in the urine or cloudy, strong-smelling urine. This can be indicative of microorganisms. It can be indicative of a little bit of trauma to any part of the urinary tract system. Honestly, with UTIs, the symptoms vary among individuals, and they depend on the specific type of infection. So you may also see these following symptoms in some patients. They may complain of an uncomfortable pressure above the pubic bone, a fullness in the rectum. That's especially true with men. Pain in the back or side below the ribs. And again, that's typically in the back is typically where your kidneys are below the ribs. And that could especially be true if the infection was like a pyelonephritis up in the kidneys. Nausea, vomiting, fever, irritability, and also a loss of appetite. This is more common in kids, but it can also be present in adults. Okay, as far as the diagnosis of a UTI, there's two stages of diagnoses. So the first thing we do is collect a sample of urine for evaluation. We use a clean catch procedure, which most of you should be familiar with. And then we test the antibiotic sensitivity of the organism's presence. So we talked a little bit about this in lab when we did the disc diffusion activity, but essentially what a microbiologist does is they streak the sample on a blood agar plate, and then if microbial growth occurs, the organisms are tested with various antibiotic discs to identify the most effective. And that is referred to as the sensitivity test. Okay, a couple different types of infections of the urinary tract. First one is urethritis. This is limited to the urethra. Again, the urethra is much longer in men than in women. The most common causative agents would be E. coli, which is typically the most common, and then chlamydia, mycoplasma, trichomonas vaginalis, enterococci, and candida albicans. Now, the most common source of urethritis in an older or hospitalized patient is from a catheter. And if catheter-related UTIs, or we call them CAUTIs, catheter-associated urinary tract infections, are not caught early, the infection can travel up the catheter and spread to the urinary bladder and continue on up in the urinary tract. It can be far worse than just urethritis. Then we have cystitis. This is typically an infection of the urinary bladder. It's referred to as a bladder infection, and it's typically caused by E. coli. Bacteria travel up the urethra, sometimes via a catheter if the patient has one, into the bladder. Other bacteria that may cause cystitis could be Staphylococcus, Proteus, Enterobacter, Klebsiella, and Candida. If untreated, cystitis can spread to the kidneys and cause a more serious infection. As far as treatment, it's typically lots and lots and lots of water and antimicrobial drugs. Again, the type of antimicrobial drugs will depend on the culture and sensitivity. Okay, we talked a little bit about pyelonephritis in lab. You should all know by now that pyelonephritis is an infection of a kidney. Could be one or both kidneys that are involved. The same organisms that are responsible for most cases of cystitis that we just talked about in the previous slide are also typically responsible for pyelonephritis. The thing about pyelonephritis is, if it's left untreated, it can cause extensive and permanent damage to the patient's kidneys. Now, 80% of infections are typically due to E. coli, just like we saw with cystitis. But if you look here, and I know I showed this picture in class, but if you look at a normal kidney on the left and then a kidney that has pyelonephritis, you can see a lot of scarring, atrophy, and inflammation of the kidney on the right, and that is the one that was infected with pyelonephritis. You guys, keep in mind, this is going to be a very serious infection because your kidneys, they do a lot for the body. I mean, you have to have your kidneys to survive. So when you have this atrophy and inflammation and scarring from a pyelonephritis that's permanent damage, that affects your person's entire body. I mean, it affects the way they excrete things, everything. The kidneys are vital to a person's health. Okay, then we have leptospirosis. Now, this is a little bit, well, not a little bit, it's a lot of bit uncommon. In fact, this is a zoonotic organism, and fewer than 100 cases are reported each year in the United States. They're spread by dogs, cats, and rats. and it's transmitted by skin and mucosal contact from urine contaminated water. And the thing about this is it's probably a little bit more common than we think, but many cases are asymptomatic, so we never test patients for this. So it probably is a little bit more than 100 cases. Those are just the cases reported per year. Okay, then we have glomerulonephritis. This is also called Bright's disease. This is when there's an inflammation and damage to the glomeruli of the kidneys. And I don't know if you remember seeing the glomeruli on one of the first couple slides of this chapter. So this is an inflammation and damage to the glomeruli of the kidneys. Sometimes patients will experience this after they've had oral strep or some sort of viral infection. Again, this left untreated can cause permanent damage to the kidneys, and it can actually be fatal. And so you can see here that inflammation of the glomeruli and all that scarring on the kidney. Again, you guys, kidneys are vital to our functioning as human beings. So this is a huge deal if left untreated and permanent damage occurs. Okay, as far as risk factors for UTIs, there's several. First of all, if you're a diabetic patient, you're more at risk for UTIs. If you're a patient and you have a catheter, you are also more at risk for UTIs. Any infants and children with abnormalities of the urinary tract are also more susceptible to UTIs. Probably the largest group of patients who suffer from UTIs are adult women. Again, anatomically, they have the highest risk of infection because of the short length of their urethra and the close proximity of the urethral opening to the anus. Thus, there's a higher risk of fecal bacteria entering the urethra. Statistics also indicate when it comes to women and UTIs that the incidence of infection increases with age and sexual activity. An important thing to keep in mind is that women who are postmenopausal are also at a super high risk because of incomplete urinary bladder emptying and the loss of estrogen, which then results in changes in the vaginal flora. In addition, the tissues of the urethra become thinner and more fragile due to a decrease in estrogen, and that provides a good environment for opportunistic infection. Sexual activity can irritate the urethra, allowing bacteria to more easily penetrate and move to the urinary bladder. Now, it's also common in men it's not common in men under 50. There's a relatively low occurrence. Again, that's because of the length of the urethra. And again, men don't have that close anatomical urethral opening to the anus, but uncircumcised men are at higher risk to develop UTIs than men who are circumcised. Okay, as far as prevention of UTIs, if we're going to use our high-risk patients, one of them being diabetics, the biggest thing is that they are a well-controlled diabetic and they are fairly compliant with their diabetic regimen. If they can control their glucose levels and their blood pressure, typically they won't have any issues with UTIs. As far as patients with catheters, I think a big thing to understand is, besides frequent cleaning of the catheter and associated areas, is the removal as soon as possible. So when I started nursing 20 years ago, we put catheters in everybody. And now we hardly put catheters in anybody. And typically we use bladder scanning as a method to see if the patient's retaining urine and kind of do screenings to screen for potential UTIs. If you have a patient with a catheter who does have a new UTI, most Most commonly, the standard of care will be to change the catheter immediately. And honestly, anymore, there's federal regulations that mandate that indwelling Foley catheters should only be used when there is a medical justification. And typically, this justification needs to be revisited and assessed every single shift by every single nurse taking care of that patient. Infants and children, the biggest thing with them with these anatomical issues is that their early detection followed by corrective surgeries or procedures to prevent UTIs from occurring. One of the biggest things is do not resist the urge to urinate. If you have to pee, go. Clean genital area before intercourse, and again, have good hygiene. Urinate after intercourse and drink plenty of water every single day. As far as treatments of UTIs, again, once a causative pathogen is identified, then the physician or provider will prescribe specific antibiotics. Commonly used antibiotics for simple UTIs, amoxicillin, ciprofloxacin, you may see Bactrim, gentamicin. So honestly, in terms of a physician figuring out the appropriate treatment, it may depend on to which category the person belongs, whether they're diabetic, pediatric, whether they're hospitalized, not hospitalized, male, female. They may also further subdivide those categories into pregnant versus non-pregnant to find just the antimicrobial that will work best for them. As far as the prognosis following treatment of UTIs, typically they clear within a few days. We usually see that the antibiotics continue for about a week or so. They need to be taken correctly, obviously, taken the full length of time, even if the patient starts to feel better. If the patient struggles with recurrent UTIs, then they may need longer course of antibiotic treatment. And typically for more severe UTIs, they may require hospitalization and IV antibiotics. It's not uncommon to see a patient who's being treated as an outpatient for a UTI with oral antibiotics maybe once or twice. So they've had like 2 full courses of that week to 10-day antibiotics, to see those patients then hospitalized and receive IV antibiotics. And that is an admission criteria, and that is just because they have basically two or more failed courses of PO antibiotics. So then they may need something a little bit stronger in IV to clear up that infection. Okay. Sorry about that, guys. So many organisms can be responsible for urinary tract infections. The most common organism is definitely Escherichia coli or E. coli. Again, I mentioned that there's other organisms that have been involved or associated with UTIs, including Klebsiella, Proteus, Enterobacter, Citrobacter, Serratia, Pseudomonas, Enterococcus, and a Staphylococcus. Infection may remain in the urethra, but obviously can travel to the bladder and either the kidneys. And we did discuss that when we talked about different types of urinary tract infections. If those are left untreated, they will spread. And the type of infection is defined by the organ or structure where the infection is present. So again, when we talk about if we think the infection is just in the urethra, it's urethritis. If it's in the bladder, we call it a cystitis. And if it's in the kidneys, we call it a pyelonephritis. In a small number of cases, UTIs have been known to be caused by organisms that originated in oral and gum infections. In these cases, the organisms that caused the UTIs traveled through the bloodstream to the kidneys, where they gave rise to a kidney infection. So again, the patient became septic in this case. In healthy individuals, however, the urinary system is designed to prevent urine from backing up into the urinary bladder to the ureters and kidneys. and the flow of urine from the bladder typically helps wash away any microorganisms. However, I stress that that is in healthy patients. And then the prostate gland in men also produces slightly basic secretions that tend to slow bacterial growth, which is another reason that we do not see UTIs as common in men as we do in women. Okay, this is just a table of the different causative organisms and how their transmission and what organs they generally affect or target, and the different signs and symptoms, and then treatment. Again, we know that most UTIs are caused by bacteria, so you will see the organisms identified in this particular graph that you see or table that you see are bacteria. Okay, now, sometimes we see viral, fungal, or parasitic UTIs. And if you look, the slide just kind of breaks down the different categories. So you see the different types of viruses that may cause a viral UTI. Again, viral UTIs are rare, but certain viruses may be found in the urine even in the absence of any urinary tract infection or disease. So either the patient's asymptomatic or it just happens to be part of their normal flora. Fungal infections of the urinary tract, they affect primarily the bladders and kidneys. Candida is typically the most common causative agent of fungal infections of the urinary tract. And then as far as parasitic UTIs, very few parasites cause UTIs in humans. You'll see the names of them there. The main cause of schistosomiasis is the contamination of water supplies with human waste. I'm going to spell that. schistosomiasis. Okay, everyone, that concludes our PowerPoint over Chapter 19, which is the urinary tract system and urinary infections. If you have any questions or concerns, please feel free to reach out to me. Thank you. Have a great night.